Makhafola joins us now to talk more on this development. Good to have you, and thank you very much for your time tonight on In Focus. How long did the folks at Ward 50 been without a clinic?
So Ward 50 clinic, it's actually a new clinic that's built on, but the clinic was there. It was just not sufficient to offer the services as a package of a PHC. So we had a clinic on the site, so we had to negotiate land that was next to the other clinic. So where we had to build a new clinic where it's going to be able to render all the services of public health care.
Right. So what does this facility have?
So the clinic has 18 consulting rooms. It has an emergency room, a new fully furnished emergency room. It also has 2 sessional doctors who are actually coming twice a week. We have also a room that's accommodated for the social services, where we get our social worker who goes there once a week as well. Has the bathroom, staff, kitchen, toilet, disabled, non-disabled, which is something that we didn't have previously. So they were actually operating in a 4 consultation room clinic. The one that we have just, for now, put it aside, but we are planning to use it for a substance abuse center. Yeah. So, yeah, 18 consultation rooms that have been opened today inside the clinic.
A fairly significant property that would require you to staff it adequately, especially with the vision that you have of having this being declared one of the 24-hour clinics that are available in the area. What will it take? Why can't you do it now? I mean, you announced, you said it's one of those that will become that in the future.
Correct. So for you to run a 24-hour clinic, there's quite a number of things that are actually required for you to run it. Number one, it would be the medical equipment that one needs to have for you to run a 24-hour clinic. For instance, we need to have an MOU, which is a maternity obstetric unit, where women who are pregnant are able to give birth. We also need to have an X-ray machine which has to be installed into the clinic. The emergency room must be equipped with beds where we can be able to accommodate at least 4 to 6 people in case of emergencies. So the clinic itself must be equipped with medical equipment that will be able, able the clinicians or the nurses inside the clinic for them to render emergency medical services. So we need equipment fitted inside the clinic first before we can actually run it for 24 hours. Yeah. So the infrastructure is fine. The rooms are adequate. The space, the parking space, is where we can be able to accommodate our 2 ambulances inside the clinic. Everything is fine. So the only thing that we are short of now is to make sure we equip the clinic with medical equipment.
And how much time have you given yourself, particularly to bring this particular clinic to that level of being equipped?
So this clinic will be on the list. It will be the 3rd on the list, actually. So we have 2 identified clinics that we already have in the city of Johannesburg, one in Region B, one in Region C. So this will be a Region C again. Yeah. So not to put ourselves too much at pressure, but we are looking at opening the first clinic for the 24 hours around about April. It's either mid-April or beginning of May. So that would be the first one. Then subsequently, the other 2 will follow after that.
Yeah. Tell me then about your broad vision of converting a clinic like this one and the other 2 that you're already mentioning to becoming community health centers. How different is that from what they are right now?
So what's happening at the moment is what we are calling a PHC. So with a PHC, the only thing that you can render, or the services that you can render only your acute, your chronic illnesses. You can also do emergencies, but not those intensified emergencies. So when you get emergencies that you won't be able to actually assist or render inside the clinic, then you have to refer the patients then to a hospital. That's what's being done currently at a PHC level, primary health care. Yeah. So with a CHC, then it's a different, so it's a 24-hour clinic. It's more like a mini hospitals, where obviously we'll be running less the burden of the hospitals that we are having in the city of Johannesburg. Already our hospitals are not able to actually provide services to our people because there's a lot, and we have limited number of community health services. So with regards to community health services, we'll have, like you're saying, the first thing, an important thing, is to make sure there's staff adequate. It's on the level of a community health service. So we need to put more staff inside to actually help. So with this one that I actually mentioned, with the one of the two that was already on the list, we are looking at doing a hybrid mode. Hybrid meaning we'll be actually roping in the provincial government to actually help us. So they themselves will be doing the after service, which is from 4 o'clock up until the following day. So they will be actually rendering the emergency services while ourselves are actually doing the PHC services. That's how we're going to start it off, and then we see how it takes us and how best we can work around the other clinics that will be introducing as 24 hours. Yeah. So that's the difference between the primary health care and the community
health centers. Yes. Do you see that being a hurdle? I mean, the fact that you have to be collaborating with the province here, who, I mean, as we speak, are facing a lot of protest action from nurses and other staff in the health profession, are saying we want to be taken in on a full-time basis, and they are citing budgetary constraints.
Hence, we are doing the hybrid, and we're not actually handing over the clinic for them to run. It's not going to be like that, because we want to be in charge of the services that will be rendered at those particular clinics. So I want to have an access to go and look myself or monitor the services that are being offered. Obviously, when they are there, it doesn't mean they are taking over the services. No, it's our clinic. It's been run by the City of Joburg clinic. It's been run by the City of Joburg. But we are doing it collaboratively, because at the current moment, some of the services, we won't be able to offer them due to financial constraints. But because we are putting the patients of the community as interest first rather than ours, hence we had to rope in the provincial government so that they can come and offer those services that we are currently not able to offer. We want to do it as a 24 hours, but we can't do some of the services. Then why can't we let the provincial government come and help us where we can't? We're not giving them the clinics to run. The clinics will be run by us, but they are just coming in to offer some of the services we won't be able to provide for now.
So you're saying this is for the good of the community. And we've seen something that is rather, what do you say, baffling about the South African community, especially during service delivery protests, that they begin to destroy infrastructure like the one that you've just built, clinics, libraries, and the likes. What degree of education and community engagement are you incorporating into this after you have built this infrastructure, that this very same community that it serves would actually protect it, keep it clean, keep it functional, keep it the way that it's supposed to be?
I'm actually raised that question. I'm actually glad. That was the fundamental reason why we did this grand opening today at Bophelong Clinic. Because number one, for you to make sure that the clinic is actually safe and guarded, we need the community on board. So the main reason why we had to call the community and alert them, because we are relying on them. The community are there on a daily basis. They can be the only people who can be able to protect the clinic as theirs. So once you present the clinic to them, this is your clinic, they now, even themselves, because they know the clinic is offering themselves services that they need on a daily basis, they are able to provide the safety, or they are able to always look out after the clinic, whether there is people or there are no people. Like, for instance, on weekends we are not operating. The community are able to watch the clinic because they know it's something that they need. So we always involve the community. There's nothing you can do without involving the community. You will be actually setting yourself up for a failure, because it starts with the community for something to happen or for something to take place. For them to reach where we want to be, or where we also open it up for the community. What is it that they want to see? Just to get in touch with them so that we can be able to improve ourselves, because obviously the services that are there, we are not always there to monitor them. So they actually advised us what is it that we need to do. We have community CPF. So we've involved those people. They are able to vanguard the clinics or all the facilities that we actually bring into the communities. So the first thing you have to do is to obviously involve the community in each and everything that you do.
Yeah. So some of the ideas, some of the innovation that you are bringing here, for example, psychosocial services that you want to bring, a GBV desk, and I see you want to deal with some HIV, diabetes, hypertension issues as well. Are these the inputs that are coming from the community?
Those are services that already are there in the primary healthcare centers. So we do have a variety of services, including those you just mentioned now. they are already there, but the GBV desk is the one that's not there, and it's something that we're actually looking into. Running social development as well in the city of Johannesburg, that we have a unit that deals with the gender-based violence. So under the social services, so we also created a room inside the clinic that's actually going to be dealing with social services, be it your gender-based violence, be it your social development problems, be it your communities that requires to see a social worker. Those kind of services that are actually being serviced there in the community. So the GBV is the one that's actually going to be introduced, which is not commonly known, but I wouldn't say it's new, because the social workers that are actually providing the services, they're actually already working on the GBV matters that are arising inside the communities. So they're able to address those. It's just something that we had to make the community aware of the services that they are being offered at the clinic, because some of the things are not known. Hence, it's always important for you to, when you do an official opening, that's where you educate the people what's there that they must expect inside the clinic, what services must be provided to them. Some of them, they were not even aware that we actually have those services at the clinic. But then when you do a grand opening where you raise awareness, where you educate people about the services that we're offering in the clinic, then it's a good thing that they know, when I experience this such and such a matter, then I have to go to the clinic, I will definitely get help.
These are long-term plans, one would say, that you are looking at, that will probably depend on the building of stacking of budgets in various financial periods to be able to carry out your full plan as you see it. With the instability that we see in metro municipalities, you don't think you'll be affected? I mean, are you confident you will be in this particular position for the long run of you having to implement your plan?
I'm definitely confident about that, because most of the things we're already actually doing. So what we had to do now, because of the financial constraints that we're actually having, we had to look at projects that are maybe 80% done and above. Then we had to target those so that we are able to actually finish them and not start something new when we have other things that are hanging to be finished. So yeah, we're looking at doing that. We have projects that we're having at the current moment, but we're waiting for the new financial year to actually make sure that they are fully taken out, or they actually find a way of finding expression in our social development or the health department, either of them. But we will make sure that we will render, or we will make sure that we will reach our plans. We will reach our plans.
Right.
So we still have the 100 days that are still standing.
Right.
So some of the projects, we actually put them there.
All right, fantastic. MMC, I appreciate your time. Thank you very much for coming on tonight. That's the City of Johannesburg, MMC.